Hello, welcome to any community. In this particular video, we are going to discuss the concept of Medovaha Srotodushti. In this, we are going to discuss about what are the possible causes of Medovaha Srotas and how to identify the Medovaha Srotodushti and what lakshana or clinical features will be observed when there is injury to Medovaha Srotas as such. When you think about the Medovaha Srotas, it is one of the Srotas that is actually responsible for the movement of the Medo Dhatu in the body. The properly functioning Medo Dhatu is responsible for the Snehana, that means the providing the unctuousness to the human body in appropriate quantity. Whenever the Medo Srotas is being afflicted, there may be a possibility of affliction of either one Srotomula or both the Srotomula affliction can be observed. As per the Charaka, the Vrikka and Vapavahanam cha, Medovahanam Srotasam Vrikka and Vapavahanam cha. So that means there may be a possibility of the affliction of either Vrikka or Vapavahana. So that means there may be a possibility of entry of the pathogen either through Vrikka may be possible or through Vapavahana may be possible. So in that particular sense, in due course of time, there may be a possibility of affliction of either the other Srotomula may be possible. As far as Nidana of Medovaha Srotodushti are concerned, Charaka says, Avyayama Diva Swapna Medyanam Jativakshanat Medovahini Dushyanti Varunyaschati Sevanat. If you split this particular shloka, Avyayamat Diva Swapnat Medyanam Cha Atibhakshanat Medovahini Dushyanti Varunyaha Cha Atisevanat. So, Medovahini Avyayamat Diva Swapnat Medyanam Cha Atibhakshanat Varunyaha cha atisevanat dushyanti is the meaning of that. If you look into the meaning of each of these nidana, avyayama refers to lack of physical exercise. Diva swapna, the person will be doing the sleeping during daytime, maybe after lunch, etc. Medyanam chati bhakshanat, excess consumption of substances which increase the medo dhatu in the body. For example, excessive kafakara substances, guru madhura rasati tigda digdhekshu bhaksha, etc. If the person is going to take these substances in excess, there may be a possibility of increase of the medo dhatu in the body. Varunyaha cha atisevana. The excess consumption of intoxicating substances, they are responsible for the affliction of a medo dhatu or Medovaha Srotas will be afflicted. Avyayam. So that means there will be the lack of exercise. Naturally, whenever the input is equal to output, the person will be having the proper nourishment of the tissues as such. So that means the nutrients will not be getting converted into the fat as such. That is, carbohydrate will not be converted into fat. When the person is doing the less amount of the exercise, so that means the input will be more than the output. In that particular situation, the carbohydrate which will be getting converted into the fat. So that means initially that will be getting into the circulating fat, later that will be converted into stored fat. This is what we can say the avyayama may be responsible for the increased amount of the medo dhatu in the body. Diva swapna, the same thing. So, if the person is doing the diva swapna, naturally the carbohydrate will be getting converted into fat. So that means the input will be more than the output. Thereby, the person may have Medovaha Srotas affliction. Medyanam chati bhakshana, excessive consumption of the substances which will be increasing the medo dhatu. For example, excess consumption of the kafakara substances. For example, the excessive amount of the sweets or dadhi, etc. So that will be responsible for the increase of medo dhatu in the body. Varunyaha atisevana. So that means the intoxicating substances. So that means whenever the person is going to take more amount of the intoxicating substances, naturally, so that will be responsible for the reduction in the carbohydrate. When there is reduction in the carbohydrate, the body gets converting it, the getting its nutrition from the stored fat. So that means that will be getting into circulating fat. Thereby, these circulating fat may get deposited in different body parts, maybe in the brain, may be responsible for the Pakshagata manifestation, or maybe it may be deposited in the blood vessels which is supplying the blood supply to the heart. Thereby, the person may develop the, what do you say, that the ischemic changes, that is the ischemic heart disease manifestation, etc., that is going to get manifested. Thus, the Nidana, that may be whatever the Nidana that were being mentioned, so that is wherein the input will be more than the output. Thereby, the person will be having the affliction of a Medo Dhatu in the body may happen. What lakshanas that we are going to observe? Meda samshayastu prachakshmahe ninditani pramehana purvarupani anicha. So here, the ninditani pramehana purvarupa. So that is specifically Yesha Jatilatva. So that means the matted hair appearance that will be observed. Along with that, Ninditani. So that means the Atisthula Lakshanas. So that is the Ayusho Hrasaha, Javoparodaha, Vrishravyavayata, Daurbalyam, Daurgandhyam, Svedabadaha, Shudati Matram, Pipasati Yogaha. So that means Ayusho Hrasaha. These are the 8 Lakshanas. Ayusho Hrasa, etc. 8 Lakshanas will be observed in the patient if there is Medovaha Srotodushti are being present. Kesha Jatilatva. So that is matted appearance of scalp hair. So that means the excessive formation of the dandruff, etc. that can be observed. Atisthula Purusha Lakshana. That is less amount of the lifespan. Ayusho Hrasaha. Because of the heavy body parts, the person will be having the Javoparodaha. So that means the movement of the body part, that is speed, that will be less. Krishravayata. Because of the abdominal fat accumulation, the person is not in a position to perform the sexual intercourse. Daurgandhya. This will be observed due to excessive sweating. So, ammoniacal smell may be observed. Daurbalyam. As the person is having the less carbohydrate, naturally, so that will be responsible for the fat metabolization. Thereby, the person may have fatigue. Svedabadaha. Excessive sweating will be observed. Atikshuda and atipyavasa. So that is the excessive appetite and excess thirst will be observed. If these are being observed in an individual, then we are going to say there may be a possibility of a Medovaha Srotas affliction. As far as Medovaha Sroto Vittha Lakshana, what Lakshana that can be observed in case of the injury to the Medovaha Srotas? Svedagamanam, Snidhangata, Talushoshaha, Stula Shofata, Pipasacha. When there is injury to Medovaha Srotas, there may be a possibility of Svedagamanam. Excessive sweating may be observed. Snigdhangata. Unctuous body parts may be observed. Talushoshaha. That is dryness of the palate region. Stula shofata. Huge swelling may be observed. Pipasa. That will be thirst may be observed. Profuse sweating. Whenever there is the injury to Medovaha Srotas, there may be a profuse sweating may be possible. Snigdhangata. This can be attributable to the disuse. Because of the injury, the person may be having the less movement itself. Mobility will be reduced. When there is mobility is reduced, naturally the input will be more than the output. Thereby, there will be a possibility of the deposition of this particular fat in the subcutaneous tissues. Thereby, the person may be developing snigdhangata. Talushoshaha. This can be attributable to the dehydration may be possible. So that is because of the excessive sweating, there may be dehydration may be possible. Stula Shofata. Again, this can be attributable to disuse or lack of movement. Pipasa. This can be attributable to, again, that is the hypovolemia. Hypovolemia may be observed. The take-home messages from today's discussion are: Medovaha Srotas is concerned with Snehana to the body. That means giving the Snehana to the body, or that means the providing the unctuousness to the body. Vrikka and Vapavahana are considered to be Srotomula of Medovaha Srotas. So that means whenever there is affliction of Medovaha Srotas, there may be a possibility of either Vrikka affliction may be possible, or Vapavahana affliction may be possible, or Vrikka and Vapavahana affliction may be possible, depending upon the nature of Nidana Sevana. As far as the causative factors of the Medovaha Srotodushti are concerned, Avyayama, lack of physical exercise, Diva Swapna, sleeping during daytime, Midyanam cha Atibhakshana, so that is the excess consumption of substances which increase the Medo Dhatu. Then Varuni, that means the excess consumption of what do you say, that intoxicating substances are leading to Medovaha Srotas affliction. As far as Medovaha Srotodushti Lakshanas are concerned, Kesha Jatilatva, so that is matted appearance of scalp hair, and the Atisthula Lakshanas, that is Aishu Hrasa Javoparodaha, Prichavavayata, Daurgandhyam, Daurbalyam, Svedabadha, Kshudati Matapasati Yogascheti will be observed. When there is injury to the Medovaha Srotas, there may be a possibility of Svedagamana, Snigdhangata, Talushoshaha, Stula Shofata, and Pipasa. That's all for today. Dear ANA community, what are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.